welcome everybody for a very small talk about menarche to menopause. So these are all the women's problems, an overall view about the women's problems, or I would say the women's health, which we're going to discuss today. So I'm not going to give you solutions. I'm just only going to tell you when you need to see a doctor, what is normal and what is abnormal. So let's start with menarche. So what's menarche? It's the normal time when we start our periods. So in Indian girls, it's generally between 10 to 16 years of age. And puberty is something when you get your puberty or achieve your puberty, which happens roughly about 2 years before that. That's when your girls start growing, they achieve a little bit of height, you can see a little bit breast, you can see pubic hair. This is puberty. And after 1-2 years, they will be getting their periods. That is called menarche. So that's the beginning of journey towards the whole lot of the women's problems or the women's world, I can say. So let's start with the problems of menarche. And yes, many mothers are worried, my daughter is growing too tall, or she started breast very early. But if you have any concerns, you can meet pediatricians or pediatric endocrinologists who take care of your child before the age of 14. You can reach out to the pediatric endocrinologist. They are the right people to deal with the pediatric endocrinological problems. Coming to menarche, so 10 to 16 years of age, anytime between 10 and 16. So what do your girls really need at that point of time? Do they get their cycles regularly? No, they may have irregular cycles in the beginning because the axis takes time to establish. The hormones will take time to establish, so it's going to be irregular in the beginning. You don't have to worry unless the child is bleeding heavily or the child is anemic, or you think, no, this is not okay. Then you may have to come back to the doctor's office for you can meet a gynecologist or an endocrinologist. So probably anybody is okay. So that's about your child's health. So how much is a normal period? How much is an abnormal period? So any time between 24 to 38 days, you can get your period. That's quite normal. So you can get it at 24, you can get 25, 26, till 38 days, your cycles. If you get your periods in between that, it's absolutely normal. So how much is the flow? So it's very difficult to measure the flow. It's very subjective. That's what I keep telling patients. The certain questions which we ask at that time is about the clots, the number of pads which you use. But normally the book says about 60 ml is normal. Anything more than 60 to 80 is a little moderate excessively flowing bleeding. Anything more than 100 ml, you're bleeding heavily. By then, I'm very sure you will recognize it by means of clots or the number of pads you're using per day. So that is when you have to again reach to your doctor about your periods. Or if it's prolonged excessively, if you're getting your periods for more than 7 days a month, each time when you get, or if it doesn't stop, then you may have to go and meet your doctor. So I said 24 to 38 days. So 1-2 days here and there. If you get it regularly, you don't have to worry. But if you're not getting your periods even for 2 months, or it's not regular for you not to get your period at that point of time, please contact your doctor. We call it as irregular cycles. If you are getting it very late, or you're getting it very early, this is irregular menstrual cycles, or otherwise abnormal uterine bleeding. So you may have to contact your doctor. So many reasons for that. As I said, when the child is very young, so it is basically because of the hormones or the cycle not being established. We call it as hypothalamo-pituitary-ovarian axis. That is not well established in children. They will have anovulatory cycles, so it is going to take some time for them. But if you think your child is anemic, as I said, they have to see the doctor. But when it comes to adults, irregular cycles, then yes, you may have to see your doctor because it's not a normal occurrence. We were talking about polycystic ovaries. So that's the major concern these days. That is also, even it can be there for adolescent girls, or as soon as they start their periods, or it can be there for regular women as well. So polycystic ovaries is something which is bothering most of us these days. So what is exactly polycystic ovaries? So it is a syndrome. We don't call it a disease anymore. We call it a syndrome. Basically, it consists of obesity, hirsutism, that is excessive hair growth, acne, All right, you can see dark circles, or you can see pigmentation, irregular cycles. All this put together, we call it as insulin resistance. All this put together, we call it as polycystic ovarian syndrome. We don't call it a disease these days. So if the doctor diagnoses you for a polycystic ovarian syndrome, so you need to have a proper discussion with the doctor as to how to go to the root of the disease or root of the problem to solve it, rather than taking shortcuts. This is what I tell everybody: healthy lifestyle, healthy food, and exercise is very, very important, even for the children. So exercise is must. Avoid junk. That's something which, as parents, all of you have to take care of, because whatever you're giving your children at that age is what is going to be their health in the future. So kindly take care of their food habits, exercise, very important. So this is about polycystic ovaries. Some conditions like thyroid diseases, sometimes we will just miss a thyroid. So you may be putting on too much of weight, your skin must be dry. So you need to look into hypothyroidism at that point of time. So you have to reach out to the doctor if you're getting irregular cycles, or you're putting on a lot of weight and your skin changes have started and you're losing a little bit of hair. Probably you need to go back and consult your doctor. Sometimes there will be secretion in the breast. You will see some breast being heavy and you will start secretions in the breast. So that is called hyperprolactinemia. Sometimes there may be small tumors in the brain. So that also will be looked by the doctor. So you will have to reach out to the gynecologist's office. Coming to, these are about the period problems. It may be excessive, it may be less, you may be getting very frequently. I told you the regular time, that's between 24 to 38 days. Anything going abnormal, kindly reach out to your gynecologist. There's something called as intermenstrual bleeding. That means you will get your cycle regularly, but in between your cycles you will be spotting and bleeding. Sometimes post-intercourse also you will be spotting and bleeding. So you again have to consult your doctor. It may be hormonal problems, or there may be a growth on the cervix. So you will have to go back to your doctor's office to check out whether this is normal or abnormal or what's happening with you. So this is about the menstrual problems a woman can face.